Hello, my name is Dr. Michele Murray, and I am a MAID provider in Prince Edward Island. I will be speaking to what the MAID application process looks like in PEI. For patients in the community, there are many ways to connect with the MAID team. I would encourage anyone with a family doctor or nurse practitioner to start discussions with that person. If you have a home care worker or have follow-up with a specialist physician, you could also ask one of those people to connect you with the MAID team. Another option for anyone is to contact the MAID service directly through phone or email. This information can be found on the Health PEI MAID website. If you Google Health PEI MAID, it should really be the first hit. After you leave a message or send an email, someone will likely get back to you within a few days. Then you will hear from somebody who will contact you and likely ask a few questions to get a sense of your timeline and contact information. They will put you in touch with the MAID Assessor, who will likely contact you directly. Anyone in the circle of care can call the Health PEI clinic service to start the process. It doesn't have to be the patient themselves, but that patient who is seeking MAID should be well informed and involved in the decision to pursue MAID. For patients who are in hospital, you can ask anyone in your circle of care to contact the MAID team. This can be your nurse, your floor social worker, the doctor who is seeing you every day, or you can also contact the MAID service directly by using the contact information on the Health PEI MAID website. Anyone who applies for MAID must complete a written request. This is a document that states you want to be assessed for MAID. There are many opportunities to delay or change your mind about MAID. This document just needs to be signed in the presence of a witness. If you are unable to sign the form, for example, if you have a medical condition that makes it holding a pen difficult, another person can sign on your behalf as long as they meet criteria by law. The requirement for proxies include the person has to be at least 18 years old. They need to understand the person's request for MAID. They cannot be a beneficiary under the will of the person or benefit in any way, financial or material, from the result of the person's death. This proxy must sign in presence of the person who is requesting MAID and the witness. The request form also needs to be signed in the presence of an independent witness. This independent witness must also be 18 years of age. This witness must know the patient or be able to verify their identity. The witness cannot be a beneficiary under the will of the person making the request for MAID and cannot be a recipient in any way of financial or other benefit from the person's death. The witness cannot be the owner or operator of a healthcare facility where the person is making the request for MAID, but this person can be the person's nurse, social worker, or personal care worker. The witness cannot be the MAID assessor. If you are struggling to find a witness for your form, you can contact Dying with Dignity Canada or ask the MAID team to help locate a witness for the request form. The form can be provided to you by the MAID team, or you can download directly from the Health PEI MAID website. After the form is complete, it can be given directly to the MAID assessor or given to the MAID team. There are two separate and independent assessments done by two different assessors, which can be either medical doctors or nurse practitioners. The assessments can happen at home, in a long-term care facility or any other publicly funded care facility, in clinic or in hospital. Some assessments take 15 minutes and others can take 30 to 45 minutes. The assessors will review your journey through the medical condition and discuss the factors that may have contributed to your decision to request MAID. It is very important for the MAID assessors to know that there is no pressure or coercion placed on the patient requesting MAID, and to be sure the patient knows they can withdraw their request at any time. The procedure of MAID is sometimes called a provision. This can happen almost anywhere, at home, in the patient's bed, surrounded by the people that are important to them, in a hospital, or in a care facility. The time and location is a joint decision between the MAID provider and the patient and their family. There are two ways a MAID procedure is done. The first and most common method is by medication given through an IV. Typically, a nurse will insert an IV or two IVs on the day of the procedure. After the IV is placed, the rest of the procedure is painless and very peaceful. The medications are given through the IV over a 5 to 10 minute time frame, during which time the patient will fall asleep in a peaceful way. There is never a concern of loss of bowel or bladder function. The MAID provider will confirm death shortly after. The other way a MAID procedure is done is by self-administration of medication by drinking medications. In this case, patient will also fall asleep peacefully. Process of death can sometimes take longer, sometime between 15 minutes to 2 hours worth of time. If there are any important rituals or procedures around the death that's really important to the family or a patient, this is something that MAID providers are flexible about and really want to make this experience to be patient-centered around whatever is important to the patient. We're very committed to being supportive throughout the process of MAID to everybody involved in the patient's circle of care.